All right, first thing we're going to do, PPE, BSI, Scene Secure. How many patients do I have? What's the mechanism of injury? Do I need additional resources? Take C-spine, have somebody control C-spine. Now I'm going to do a quick assessment. What's the general impression of the patient while I'm doing my assessment? Hey, are you okay? If he is unconscious, I'm going to do a jaw thrust. Look, listen, and feel. I'm listening for breathing. I need to know the rate, rhythm, and quality. If there's any gurgling, we'll suction. If there's any other snoring or anything like that, we'll place any airway adjunct that we need that's necessary. Apply oxygen at this point. We want to make sure that there's not any breathing problems, significant breathing problems that we need to fix. So I'm going to do, just listen to lung sounds real quick, make sure that they're equal. Now I want to do, we've done airway, we've done breathing. Now we're going to check circulation. I've got my fingers on a central pulse, also on a peripheral pulse. While I'm doing this, I'm feeling the skin so I can get the skin color, temperature, and texture. Once I do that, along with circulation, we need to do a hemorrhage sweep. We want to see if there's any life-threatening hemorrhage. This is the primary survey. Primary survey is life threats. That's the only thing we're interested in. Okay? Don't see any significant bleeding. We'll go ahead and start treating them for shock. Primarily make sure that they're covered. Make sure we got oxygenation in place. We want to prepare the patient. At this point, we'll identify them as a load and go patient. We want to get whatever we need to do to get them packaged. Any secondary injuries we'll get to, but right now we know we need to go. It's a load and go. If we have to wait for another transport unit, if we're waiting for a helicopter or something like that, then we'll get into the secondary assessment. But we need a set of baseline vital signs right now. If we can get a sample history, we want to get that sample history at this point. So baseline vitals we've got, we're trying to get a sample history. We've packaged, we're ready to go. Now we'll do a secondary survey. Secondary survey, now we're looking for any secondary injuries, anything that's not life-threatening. Now we fix what we find as we find it. We'll start at the head. We want to feel the head. We're feeling for deformities, contusions, abrasions, penetrations, punctures, lacerations, swelling, instability, crepitus. I'm looking at his eyes, checking for pupillary response, looking in the nose for fluid, blood, anything like that, in the mouth, anything that may cause airway obstruction. I want to look in his ears. I also want to look behind the ears. Look at the trachea, make sure it's in midline. Check the neck, you're looking for JVD. You want to palpate the back of the neck, palpate the cervical spine. At this point, you can place a C-collar. We'll come down the chest. Again, we're looking for deformities, contusions, abrasions, penetrations, punctures, lacerations, swelling, tenderness, instability, and crepitus. We'll shorten that to simply DCAP BLS TIC. Press down on the chest, looking for equal chest rise, looking for any movement, any paradoxical movement, or any pain. I'll squeeze the chest, same principle. Now I want to do a thorough set of lung sounds. Listen in 4 different places. Minimum. Too high, too low. If you can, you want to get an axillary as well. Get them up high in the axillary. Okay. Again, if you find an injury, you fix it. We also want to remove the patient's clothing. We call it trauma naked. We want to make sure that we can see all of their body so we don't miss any injuries. I've done the chest. I'm going to check the abdomen. Again, DCAP BLS TIC. Down here specifically looking for any bruising, any tenderness, especially any rigidity. Check the pelvis. Push down. Squeeze in. I'll do an elbow sweep for a priapism. I'm coming down the femur, kneecap, lower leg, all the way down the lower leg. If the patient is conscious, I'll have them push. I'll have them pull. If not, I'll run a pin or something up their foot to see if they flex from that. I want to check distal pulses down here. You can also check capillary refill. I need to check the arms, palpate them. Again, DCAT, BLS, TIC is what we're looking for. I check radial pulses, capillary refill if I need to. If they will, I'll have them squeeze my fingers. Last thing we need to do, check the back. Again, secondary assessment, we're finding injuries and fixing them at this point. Holding C-spine, work as a team to log roll, prepare to roll. Check the back, head, down here. Gunshot wounds, you're looking for any exit wounds as well, down the butt, legs. Again, you can get significant blood pooling back here that you may not have found on your initial survey. Fix the problems that you find. Again, we've treated for shock, that we've got them covered. We got oxygenation. We're transporting. We'll do secondary assessments as necessary. Follow up, check your interventions, reassess the patient. Trauma patients, significant injuries, any critical patient, you always want to reassess them. Minimum of every 5 minutes. Again, you're checking any injuries, any treatments that you've done. You'll make sure that those treatments are accurate and everything's still going like it should, and transport the patient.